We're back with our next episode of Real Talk with a Foot Doc. As always, I'm joined by Dr. Edgar Sy of Relief and Dr. David Schweibish. I'm Dr. Tim Miller, and our next episode, we're going to tackle some things that we see in our offices all the time. And we're going to label this episode Filters, Feet, and False Standards, the Social Media Trap. Because nowadays, we're all bombarded with information, right? We get a ton of information through social media, through the news, through websites. And nowadays, I don't have one person walk into my office that doesn't have papers printed out or text on their phone or websites showing me what they think they have, what they've treated, what was the next trend that they saw on Instagram or TikTok that kind of pushed them towards some treatments that they've started. And those treatments most likely have not worked, and now they're coming to see us and say, okay, hey, listen, I tried this didn't work. What are the next steps? And I find that we're not just fighting their expectations, the patient's expectations of what they expect out of their appointment, but we're fighting these influencers. We're fighting these people that aren't necessarily medically trained, right? It's somewhere where maybe a neighbor saw something on TikTok to try this certain essential oil or to try this certain spice out of their cabinet, mix it with water and soak their feet in it to see if it happens or see if it helps them get any better. And it's something that you're almost, instead of building up their expectations and building up their treatments, you have to break down walls first. You know, when as little as 20 years ago, doctors weren't doing that because it wasn't so easily accessible, all of this information. But now you have to break down these walls, break down what they've started to try to build up to a treatment where we know that they're going to get better. So,
Yeah, I agree. I think patients are coming in more educated than ever, right? They kind of come in, they kind of did their homework. They're kind of guessing, or at least having an educated guess too. Like, hey, I'm coming in, I think I have plantar fasciitis. You could tell they did their Google. And then with that comes their treatment plan that they research. So I think as a provider now, it is difficult because you have to manage their expectations and at the same time tell them what works and what doesn't work. And now when I doctor, I actually tell them all the options I do. I go, I don't like this because I do this, but it is an option. So it does allow patients are coming in smarter than ever.
Yeah, and I think you alluded to this, just a moment ago, is that you are having to, first of all, tackle the fact that they've probably established some level of trust with that person that they've gotten guidance from, okay? You may have a relative or passively perhaps an influencer of some kind with some kind of following, some sort of traction that they listen to. They believe that there's some semblance of credibility there, and that may or may not be the case. And unfortunately, that information that they take, for some people, it obviously predisposes them to thinking, hey, this is what is wrong with me. And I think an essential part of being a doctor is about getting to an accurate diagnosis. And you can't accurately diagnose just by listening to somebody's reel or seeing a post on any kind of social media.
I mean, it's 30 seconds, right? You're
Yeah.
getting like a clip of 30 seconds.
Yeah,
of what
correct.
it is,
And obviously we can listen to our own symptoms, we can read things, we can interpret information as human beings. I think that's a logical thing to do, but unfortunately without accurate assessment, sometimes imaging, sometimes a good clinical exam, you can't say for sure that what you're actually coming across online is valid for what you're presenting with. So.
Absolutely. And I think this social media topic is so broad. We're going to spread this over a couple episodes, but the first thing I want to throw out to everybody here and to our audience to think about as well too is the fact that social media, these perceptions on social media, they impact how people view themselves, right? We see these celebrities, we see these, people talking and they're doing certain things, and Dr. Sy is playing footsie with me under the table. It's kind of weird. But that's but look at his lateral mallets, they're fantastic. Lateral mallets ankles, by the way, and Dr. Sy's got fantastic looking ankles. But the filters that are available through social media, these poses, these lights, the way that people are posted on these outlets and how the general public perceives them, it's such an influence on how we feel about ourselves, right? But one of the things that we may not necessarily see a lot of is feet, right? There's not a lot of positive views on feet, right? And that's what we come in. We try to help our patients and our audience as well about the positivity that we can have with our feet, right? And one of the things that can negatively affect you is when people don't like the way that their feet look or the way their feet feel. So, Dr. Schweibish, when you have people coming in talking about social media, what are some things that they're bringing up, and how are you trying to change their perception about that?
It's surprisingly common. It's interesting how often, at least in my practice, I have patients coming in telling me right off the bat, I just don't like the way my feet look. And there could be a layer of embarrassment or shock to having to, expose themselves to somebody else. And some people literally, you walk in the room, they still have their shoes on or their socks on, and they
even
don't
when
want
your
to show
MA
you.
say take
Yeah,
off your shoe, but it's
correct. And so it just starts right there, where there's a layer of perhaps embarrassment to the fact that they have a foot problem or an appearance to that foot that makes them feel like they don't want to show the world. Okay. And in my opinion, I do feel like, unfortunately, with social media and the way that it's evolved, some of that problem, the issues that people have with their own feet, do stem from what they see and what they hear on social media. I mean, there's not a lot, like you said, there's not a lot out there in the world of, body positivity as it pertains to your feet, but especially where I'm at, where people are wearing open-toed shoes, they're walking barefooted, they're wearing flip-flops with some regularity, people in my environment do actually take the appearance of their feet very seriously. And I think a lot of that is, hey, I had photos of myself taken on the beach, and I zoomed in on that photo of my foot, and I noticed that my foot does not look like the girl that was standing next to me or the guy that I saw in this other photo online. Why is that? And that brings them into my office to have those conversations about what it is that makes me different. So.
Yeah, no, I agree. I think feet are kind of like a tires to a car, right? Without it, you really can't function. So I do think it's important, but I agree. Practicing in like Miami, Florida, men and females just want their feet to look great. And usually with the social media, the most commonly I see is when patients have bunions, and through the social media, through YouTube advertisements, they find that they think that those little stretching bracing will fix their bunions, and unfortunately it doesn't. But
Mythbusters.
The Mythbusters, exactly. But the power of social media is that, the everyday people will believe that, purchase, spend their money, try to see if their bunions get fixed. So no, I completely agree. I think it's extremely prevalent, whether it's musculoskeletal deformity like a bunion, or it could even be something simple like toenail fungus, to a point where some people, their toenail fungus is so bad, when we talk about treatment options, but they're just like, I need it gone, and end up taking out the whole nail and starting over, and they do a press on, or they just paint on their skin. So it's very surprisingly, a lot of people care about their appearance of their feet.
And that's something that we're bringing up because of the positivity, right? There's not a lot of positivity around social media in feet, and even social media in general, because people are coming in because they don't like what they see. They see something that they view as perfect on social media, or something that's presented to them. Meanwhile, that stuff on social media is through filters, right? It's through, editing. There are things that are presented to make it look like it's perfect. And people are viewing themselves and have that negative self-image, and they're coming in asking for help, right?
Yeah.
And unfortunately, what I see too as well is when they get this negative self-image, they are looking to start fixing it, and sometimes they're trying to do these quick fixes. So they'll look at these social media influencers, or and for our audience too, a lot of these social media influencers and these people who are prevalent on social media, they get paid to do this stuff. They're not doing this necessarily for free, and they're paid for a certain product. So if you're on Instagram, social media, you brought up toe fungus, right? They'll get paid by a company to promote something about healing toe fungus, right? So you may try that as a quick fix, and you're not getting the results that you want, thus further pushing that negative self-image.
It is. And a lot of what's out there as it pertains to body positivity doesn't even talk about feet. There are a lot of resources, a lot of remedies, for patients obviously struggling with issues with weight, for example, or other issues of the human body, but in the world of the feet, there's not a lot out there. So people are always looking for resources to tackle it. They don't even know if going to see a podiatrist makes sense to do, but it does. It really does, because these issues, like you mentioned, whether it's nail fungus, some changes to their skin, some kind of a deformity or something like that, they have no idea that what they're reading or seeing online is even a problem necessarily. It's like, is it a problem? Is it something I need to fix? Or is this something that just cosmetically for me has become a concern? And again, I think that's where just even coming in to have a conversation with a podiatrist about that problem so that they can wrap their head around whether this is something that needs to be fixed, or is it something really I'm just dealing with psychologically, for example.
Do you guys find yourselves coming in your practice having that dilemma of patients asking for a surgical, like to correction without them having pain, but because of the appearance?
Oh, you bet. Yeah,
it's hard because now, at least I think a new age, because of social media, a new dilemma for us and emerging physician and surgeons is that dilemma of, do I perform a surgical procedure that there's always a risk for a patient who goes, no, I have no pain with my bunion, but I want it gone cosmetically. Any procedure, regardless of the training that you obtain, whether it's, everyone gets good training, but it's a hard dilemma. There's times where I have to say, I'm not going to do it, but then you let the patient down. And ultimately it's disappointing because you always want to make sure everyone leaves happy. But, I had one patient, he was born with a congenital deformity. He was still playing soccer, very young, playing 90 minutes. And then after, he goes like, yeah, but when I'm done playing soccer, I'm in pain. I go, what's your pain level? And he's there with his dad. He goes, well, like a 1 out of 10. And I go, 1 out of 10 after playing 90 minutes soccer, three times a week is bad. But he goes, I just need a reconstruction, where I'm like, and I had to turn him down, and they were left ultimately upset. But I just told him, if you're my brother, I just don't think you need this surgery. So I do find that it is a new dilemma that we're kind of evolving to.
And that's one of the things too. I'm glad you brought that up, is because, social media, that expectations, when patients come to see us, and for our audience, is that we, as podiatry as a whole, we try to treat you like how we would want to be treated, or how we would want to treat our family members. And I've had plenty of patients that have come to me with a picture of how they want their feet to look like, and say, make it like this. And then I'll ask them, is it inhibiting your functions? No. Are you able to do the things that you want to do? No. Then why are you here? Because I just don't like the way that it looks. And then I have to have a real conversation with them that correction, whether it's, more likely than not surgical based off what they have, there's risks with that. No surgery is perfect, right? Our goal is to make it work, but there's always risk that it doesn't work, or risk that you're in pain afterwards when you're not in pain now, right?
Correct. Yeah, or even the risk that the cosmetics of your foot may actually be worse.
Yeah.
Scar tissue formation, recurrence of deformity, or whatever it might be. And yeah, those talks about, the risk profile of what we're trying to accomplish for you, and in the pursuit of perfect, and unfortunately that concept of perfect is something that social media drives a lot of. It really does. You've got people who, when they're creating a photo for a post, or video footage for a post, they have an expectation in their mind of what they think is going to create the most likes, the most shares, whatever it is. And that level of perfection as it pertains to the feet can often be very difficult to achieve for some people. And I don't know that they get that, because in the plastic surgery world, they've got a lot of, amazing advancements in their field that can get you to an ideal relatively easy, whereas obviously with the foot, we have surgical options for these things, but they are not definitely without risk.
Yeah.
So.
And some of the, what they see when these influencers post on social media is pretty extreme. Like, because they're trying to push this perfect foot or this perfect body, and that is a huge psychological negative impact on patients too. And I feel that there are times when I'm talking with patients that I'm almost acting like a psychiatrist, right? And I'm talking them through as, this is what you see, but may not necessarily what you get, depending on what you're showing to me there. And do you guys feel that way as too? Like as podiatrists, we're almost like psychiatrists sometimes too?
Yeah, that's just beyond Cosmetic. Yeah, we're always, I don't know. I think I don't mean to go Patch Adams, another movie reference.
Robin Williams,
Robin
fantastic.
Williams. But, I think everybody, you have to make sure they're mentally always happy as well. And I think that's where the dilemma is if you're having to deny them their request of a procedure or something like that because you might do more harm than good. I think that's kind of like the dilemma. But
do no harm, that Hippocratic oath that we take.
Yeah.
Exactly.
Right?
I like the easy wins. When patients do have a nail-related issue or a skin-related issue, a dryness, a scaliness, a rash, or whatever it is that might be chronic. They think literally it's almost like I have this condition that you can never possibly get rid of. You take appropriate biopsies or whatever it might be, and then bam, you can fix that cosmetic problem. But those biomechanical things, the reconstructive things, that's a much deeper conversation for sure.
I'm curious, at least what your guys is most common. For me, the most common like cosmetic, right, that we do, I usually like corns or calluses that are on the top part of the foot, hammer toes and bunions. Usually with those, I will, at times perform those. I do a long discussion, and those ones, they do turn out well. I don't do sutures. There's subcutaneous sutures with tapes, steri strips and things like that. So the incision's minimal. But again, yeah, it is kind of still a dilemma. At least in my practice, it's not with high frequency. I do perform those, but I do err towards, hey, am I going to be able to do more good than harm? Those reconstructive ones, when they're in no pain, I definitely shy away from.
Yeah, absolutely.
But,
absolutely. And it's obtaining perfection. And, I'm always telling patients that there is no perfection, right? There's functionality.
Except when you get a haircut with your fade.
I know I didn't get it I don't have a haircut now. Usually I got a fade going now, but it's time, man. Time when you're treating patients and doing things.
When you're the host for the Real Talk with a Foot Doc,
time is precious.
Time is precious. So thanks for bringing that up, because Real Talk with a Foot Doc, FPMA is presenting that. FPMA is the Florida Podiatric Medical Association. So FPMA, every state that you're in has their own podiatric medical association. So if our audience, decides that they want to see a foot doctor, they want to see a podiatrist, you can find one either through your insurance, or if you type in, for example, if you're in Wisconsin, the Wisconsin Podiatric Medical Association, you go on their website, there's a list of podiatrists around there and you can search with zip code. So kind of a good way to find somebody who's local to you there. So
people everywhere.
They're everywhere and willing to help.
But to tie in social media, it's funny because usually back then you'd get the yellow pages, right?
Mm-hmm.
Historically. And then now, earlier you'd Google podiatrist near me, but back to social media, people are using Instagram, TikTok as a search engine to find.
They are.
And it might go a little bit deviating from patients beyond social media, but also as providers. I feel like fortunately or unfortunately, depending on your point of view, we have to have some level of presence. Because now, I just started a new job. It's been 1 year as of July, a few weeks ago. And now when patients come in, I go, hey, I introduce myself. Usually as my students work them up, and then they go like, oh, I know about you. Whether they already knew about like my social media or my bio from the website, and having that presence. So I do think now too, as a modern doctor or doctors emerging, you do have to have that social media just to kind of help patients come through the door and everything. So it works both ways. I really do. And if they have plantar fasciitis and one of your posts is about plantar fasciitis and you have patient testimonials or whatever it may be, whether it's marketing or just to kind of promote awareness, I do think in both areas, or our end and the patient's end, social media is just so prevalent.
It is, yeah. And that brings me to, I think, to one of the most critical components of thinking about social media. It's the quality of your resource. If you, for example, are posting content and it's medically related, you're a licensed physician, you're a board certified physician, you're a podiatrist who knows what they're doing. I think we can justify that the quality of your content is going to be superior to somebody with no medical license, period. And unfortunately, a lot of people who've gained a lot of traction online, perhaps hundreds of thousands, if not millions of followers who have zero medical background whatsoever, are where so many people are getting their guidance, instead of from the doctor who may only have a few hundred or thousands of followers, who really is a far more trusted and more valuable resource. And so you've got to take your information with a grain of salt. You absolutely have to do. And when patients come into me and they bring in a reel that they saw, or they something they saw on Instagram, I'm always kind of vetting the resource and saying, listen, if you're gonna take this at face value, we have to look at who that individual
Yes,
is, or what
absolutely.
that content, where is it coming from. And so much of this stuff is not grounded in science. It's
Mhm.
not. Where's the evidence-based literature? Where's the papers to substantiate this? Where's the proof to show that this is actually going to be a safe thing to do? And it's our job as podiatrists to kind of hopefully clear the air a little bit and create some semblance of grounded reality in what they're reading.
Dr. Williams got into medicine because she loves helping people. So imagine how it feels when she can offer a same-day appointment to a new patient like Mike and have his medical history right there on her tablet, with the system capturing the exam findings and plans for care. With collections up and denials down, Dr. Williams can move on to easily identifying other business matters, and she and her staff can even get in a few hours for themselves. Imagine that. ModMed, your AI-powered practice, awaits.
As physicians, specialists in the foot, ankle, leg, below the knee, come see me, right? That's where we are as podiatrists. We are experts in that area. And as doctors of podiatric medicine, DPMs, we are evidence-based doctors, right? And that's how we practice. We practice based off scientific literature, papers that have been published in medical journals, medical textbooks of treatment options that we know are proven to work, right? And that's what we specialize in. Unfortunately, now a lot of these influencers or people who promote medical treatments may have a doctor in front of them, but may not be a doctor of podiatric medicine. They may be a doctor, and I'm not slighting any other specialty, because when you become a doctor in a field, it's proven you've done the work, but you may not be trained in that evidence-based medicine of that specific part that you're talking about, right? So you may have a doctor of physical therapy who deals with musculoskeletal, talking about fungus in the toenails, right? That's not necessarily something that they're an expert in, that they have evidence-based medical training in. And that's where, Dave, you were talking about vetting your sources, right? It's so important. It's very easy to hear something for 30 seconds and be influenced by it and go along. It's taking that extra step as a patient, as somebody who has a specific ailment or something going on that they're trying to treat. It's harder to go more in depth and look at your source and do a more thorough research, right? We're now in a society where it's here, 10 seconds, 30 seconds here, all that. How are you going to take that next step? And that's where it's important for us that we see that, and those patients come in with that, because now they're taking that next step when they're coming to see us. They're spending their time, they're either taking time off work, taking time away from their families to take that next step to get better. What have they brought to you, but what are we going to do to show them, here's the evidence-based medicine, here's what you may have heard, here's why it may not be correct, and here's the correct thing to do. And I think that's why it's so important that if it's below the knee, come see me, right? And it's something that we're pushing because podiatry knows what to do. We are well trained in that area. And again, sometimes we're fighting an uphill battle of patients coming in based off their social media influence, or their influences. But we have the tools, we have the evidence-based medicine to show you, hey, this is what you got to be doing. So if there's questions, come and see us.
Yeah, they're always pretty shocked too when they kind of come in with that information. They're like, "Hey, I've been doing this. I heard it works," and then you kind of mythbuster it and tell them like, "Hey, unfortunately, tweak it like this, modify it like this, or this actually doesn't work." And they're always surprised, but it's always nice because when you give them the real information, medical and literature based, they always leave much happier because like, okay, my now I'm on the right track,
Mhm.
And but I agree, it's just kind of educating the public and not being so deceived.
And you're right. And then, on the right track, not being so deceived, because there are some dangerous, not dangerous, but, inhibitory influences out there, right? I'm sure you've seen it. I feel like we talked about this. You had a patient, you talked to me about where they were, people coming in, Barbie feet, they wanted these barefoot influencers, and it's something that can end up causing more harm than good.
It really does. I mean, and I think as surgeons, we're all trained. There's that classic motto we live by that the enemy of good is better. I mean,
That's my
it's so
favorite quote.
That's
Yeah,
I
the
love
OR,
that.
That's my favorite quote.
Yeah,
Yeah.
in the operating room, it's because when you get a result that looking at it like, hey, that looks good, like we're good, that's a great outcome. If you're just trying a little bit to try to make it perfect, sometimes it causes a worse result.
Yeah,
right?
and that's the same thing applies with patients, who they take their shoes off in front of me and I'm looking at their feet, knowing perhaps just based on information they provided in their intake paperwork, for example, that they have a cosmetic concern, take their shoes off and we're looking and seeing not much of a major problem at all. But to that patient, there's a big concern, and their pursuit is better or perfect, perhaps. And so our goal sometimes is to actually get them a little more grounded into what the fact that you actually biomechanically have a very stable foot, you don't have a very pressing problem, you don't have pain, perhaps. And so is this something that we need to fix, or is this something that we can find maybe a different solution for that doesn't require surgery? And I think ultimately you have some patients that no matter what you do, no matter how much you try to be a psychologist for them and ground them about the fact that what they have is very good, they don't need perfect or better, they're still not content. And those can be difficult situations to have, patients who truly are in pursuit of perfection, whether it's because of something that they saw on social media or just something that they have in their minds. And oftentimes for me, that's where I'll try to bring either, if they have other family members into the equation so that there's another party in the room so we can all talk together as a team. If it truly feels to me like there may be a very deeply rooted psychological issue, sometimes the primary care doctors or other members of the healthcare team will come into the equation to help to hopefully provide clarity where I may not be able to do so just on my own.
Well, and then that's a perfect point you bring up, because when patients come in and see us, our goal is to set realistic expectations, right? We want to be straight up and honest about what you have seen before, what you have tried before, what you can do to get yourself better, and the trajectory of that. And that's why when patients come and see us, we're giving that, hey, this is what's likely going to happen. And this is your expectation that you need to have in your mind, that things may not be perfect, right?
Mm-hmm.
And pursuit of that perfection can lead to things that you may not want to deal with.
Yeah, but I think ultimately to get high success, I think it is patient expectation. If you're correcting a bunion, you cannot put that toe extremely straight. Biomechanically, we're trained to know you have to have a little bit of a bunion, right? But patients expect it to be perfect. Now, cosmetically, there are considerations that we do, and we might manipulate and cheat from our understanding in the operating room or in the procedure. But I do think, yeah, I agree 100%. Leading with patient expectation prior and initially is really big. But I do want to, but this might be a little sidetrack. I have a dilemma when it comes to social media advertisements, right? So let's say a patient wants a bunion. Patient has a bunion, and there's companies out there now that are on CNN, which it's called the procedure is called Lapidus, but there's a particular company that's marketing their Lapidus very strongly. They ask for that company, and you do that procedure, but you don't use that company. Do you find that dilemma, or do you I just feel like when I'm teaching the students for surgery class, are you doing harm if you use another company to do that same procedure when they're asking for it? Because God forbid you get a complication, delayed union, but they find out you didn't use that company. Do they have the right to sue, or they're just dissatisfied? But it's the same procedure. I do think that's a new, interesting dilemma as it pertains to social media for us surgeons.
Yeah.
Is do you tell them up front, like how detailed do you tell them, like, hey, I do that same procedure, but I don't use that product, but it is the same one? Or do you just go with it because God forbid if you have a complication, they're like, I knew you should have used that other company, because when you see it on CNN, you see it and they market it so well.
Absolutely, yeah.
I don't know. Do you guys ever,
I mean, I'm very honest with patients. If they call asking, specifics about the particular type of product or procedure, I always encourage my staff to make the appointments with that patient so that we can at least get into a discussion about expectations and about why that may or may not be the right thing for them. Mm-hmm. Okay. And whether or not I use that particular system to perform the surgical repair, I do get into the weeds. I think that it's really imperative for patients to have an understanding of why that particular setup may not be ideal for their problem, or if it is, and they are insistent about being able to utilize it. And if I personally don't, then I'm happy to help, provide them with the resources necessary to get into a provider who does do that type of repair. But I still like having the conversation with patients so that they understand why I may or may not think it's appropriate for them.
That's you bring up two great points. First is that there are social media influences, TV influences, but every patient case is different, right?
Completely.
So because you saw somebody who may have had a certain thing done with one particular company, they had a great result. That may not be perfect for you.
Correct,
And that's where when I'm setting those expectations with patients, I'm telling them, hey, listen, yeah, that was a great result there. I don't think that it's going to work for you.
Yeah.
Okay. And then that's where you set those realistic
I mean, look,
expectations.
we're picking on bunions specifically right now. There are well over 100 different ways to correct a bunion surgically, just surgically. So to sit here and think that every single patient case is going to be funneled into the ability to repair it with one particular procedure, I think is very flawed. And unfortunately, a lot of the marketing that comes out makes you think that. It makes patients believe that this is the one and done solution for your problem. And it's not always the case. In fact, I think it's rarely the case that the great majority of patients are actually going to find what they need with that one particular system.
And also too is that when you're looking at things in the grand scheme with systems and choosing, right, you have to tell them that even though this is what you see, it's not necessarily what you get.
You got it.
Right.
And I'm sure it's no different. Obviously primary care doctors, every medication, every commercial we turn to now is some drug. Some kind of drug to treat some kind of problem.
By the way, we're the only country in the world that you see drug commercials.
I think us and New Zealand.
I
think in New Zealand, we're the only two countries in the world where it's legal to actually have so much copious drug.
Ask your doctor, and that's why at the end of these, so this is for our audience too, if they say in a commercial, ask your doctor about this, it's because the doctor themselves, like they basically can't get influenced on necessarily what they prescribe. So you have to ask your doctor to bring it up to have a discussion, because a lot of those ones may be FDA approved, but there's no generic medication for it yet. Right. So you have to initiate the conversation with your doctor in order for them to think about it to prescribe for you there. So, and that there's a certain thing that's why at the end of the commercial, you say, ask your doctor about this. So, and the advertising, I feel like primary care is now, there's all advertising about drugs and everything. And it's so prevalent here.
It is, yeah. So imagine you've got, companies that spend millions, if not billions of dollars doing marketing work to create these commercials. Their commercials are hopefully grounded in science and how they present them. And then we turn full circle and bring it back into social media in the hands of people with no medical training, no medical background whatsoever, who are piping or promoting a particular treatment plan. It's incredible. I mean, it truly is incredible when you think about how egregious and absurd it is that there are people who simply because they have followers and traction on social media, that they're set up to promote something that is truly out of their hands.
Absolutely. Absolutely. And it's something that you look at it, and again, they're promoting one thing, but then that one particular thing that they're promoting may have worked for them. For their 1 million+ followers, it may not.
Yeah, and I don't want to negate the fact, don't get me wrong, there's plenty of value on social media. There are plenty of treatments out there that do work. They work for a particular patient pathology. They work for a particular subsect of people. They work a certain percentage of the time. Let's not negate that fact. But unless you have clarity about what your problem is, and you've done the work or the homework to research it appropriately, and you understand the potential risks and benefits of what that treatment is, you could be setting yourself up for failure, more harm than good, long-term side effects that could be more disastrous than the problem that you initially ended up with, or some other problem altogether that you didn't anticipate having to begin with. So all these different things that come into the equation of why or why not follow what we see on social media, it all, again, comes back down to the fact that we as podiatrists, we're educators. Our job is to teach and to provide clarity. So when you come into our office, bring us what you believe you think is appropriate for what you have, and let us sift through the weeds for you. Your job as a patient is not to do that. It's our job, and that's what we're trained to do.
Absolutely.
Let us debunk for you.
Yeah.
But yeah, social media is a beauty and a curse. We have more resources to get more education to learn and everything. But I agree. Sometimes it is difficult because there can be propaganda out there that's false information being spread. And yeah, they need to do a verification button or something, like
Okay.
blue.
Verification
Yeah.
button.
I mean, and fortunately, the commentary that a lot of people put on posts, there's oftentimes a lot of value in that. You do have nurses, doctors, other people in the general public who post and say, "I tried this, do not do it. It gave me a horrible rash or a lot of pain or whatever it was." But so much of that stuff can be buried.
Mhm.
We have patients. We have only so much time in our day that we can sift through and say, well, the 714th comment on that post that you read explained the most common side effect, and unfortunately you missed that one comment. But and that's something that, again, with the layers and the mountains of data that social media develops, you cannot reasonably think that you're going to sift through everything you need to know before you try some treatment online. You just can't.
And I think we're going to get towards the end of this episode here, but I want to hit one more topic because this is a huge social media. Social media is obviously everywhere, it's very present. And so we're going to have a second episode on this. But I think what I've noticed, and I want to get your guys' opinions on it, obviously, is that I have more people now than ever hiding their feet because of what they see of what other people's feet look like, right? So I get people who come in who, it's a husband, right? And the wife's sitting there, and the wife's like, he won't show me, the wife says he won't show me his feet. I don't see it. He goes in the shower with slippers, takes off the slippers to go in the shower and comes out. And that can lead to a significant amount of harm, right? That leads to uh, improper hygiene, improper footwear, or things that can really hurt the patient. So I think that influence of social media, that negativity that's associated with it, is something that we need to address. And it's something I'm sure you guys have seen in your offices too. How are you approaching when somebody's coming and ashamed of their feet? What are you talking about?
I usually crack a bad joke saying you could be a foot model first, kind of lighten the mood, of
Yeah.
course. A bad joke, but I usually do. And then usually it's more so practicing in Miami. It's more so the patients wanting to look good in a particular shoe,
Okay.
Certain heel, and if a certain part of their foot, whether it's a hammer toe, bunion, they just go like, "Hey, I just don't really feel as attractive with this shoe on," or anything along those lines. There's times too, just in general, when they take off their shoe, but I try to avoid surgery as it pertains to that, unless it's kind of something kind of simple. But then from there, I kind of just say the risk and benefits, and if they want it, then I do perform it.
Okay.
Admittedly, just to kind of make them happy.
And I think as you're discussing this particular issue is with just the average person, okay, with no other medical comorbidities.
Mhm.
I more often, I think, see it a lot of times in patients with comorbidities such as diabetes, okay? So those patients, unfortunately, they're exposed to the same exact things on social media. They see the exact same
Absolutely.
things. They
Absolutely.
truly do. And I believe that it leads us down a road of either neglect or denial, unfortunately. And a lot of those patients live in a orthopedic shoe or a diabetic shoe, thinking, thank God for this shoe. I don't want people to see my feet and all the problems that have come from diabetes, for example, or something else. And those patients are the ones that I fear the most for, because they live in that bubble of neglect oftentimes, or thinking, well, I'd really rather not have the world see this problem, because if people are going to think it's either gross or I may have an infection that they think they can get, and vice versa, so on and so forth. Those are the patients that truly keep me awake at night, because I want them to feel compelled to say, let's work for better. Let's really try to get better for you and treat the problems that are causing you to feel either shame or something with your feet. Those are ones we can usually probably do the most for, because then it's not just grounded in the cosmetics of it, it's actually grounded in pathology that could be leading to bigger problems.
Yeah, I think for me too, it's not, besides cosmetic on social media, but it's them purchasing products, treatment ointments, whatever the pathology is. I saw this online. I bought this. Does this work? I think for me, that's where I see most of the patients kind of err towards when it comes to social media influences, buying products, seeing if it kind of works for them. And most of the time, unfortunately, it doesn't. So, yeah.
Awesome. That was great. That's great. Well,
Cool.
so
Great talk with a few foot docs.
with a few great talk with a few foot docs, real talk with a foot doc. As always, I want to thank you, Dr. Edgar Sy, Dr. David Schweibish. I'm Dr. Tim Miller. Thank you to Florida Podiatric Medical Association, FPMA. Also, as always, shout out to Doug Loran of Orlando Production, OG from OP. Thank you for all this setup. Please like, listen, follow, watch all social media platforms. We are here to help. We want to push things forward, show you what podiatry can do, and show you that podiatrists are here to help. So thank you for taking the time to listen. We're going to end our first episode on social media now. We will have a second episode coming out soon. Please, again, like, listen, follow, and tell your friends about us.
And you want to see what Dr. Schweibish is going to wear.
GQ.
If you're looking for style points, you have to tune in or see what. That's not technically Hawaiian. That's Marvel on your shirt. That is Hawaiian.
This is Hawaiian.
Hawaiian with Marvel.
Doug,
you got to see Dr. Miller's with
a
a Van Heusen Flex blazer.
Yes.
Wow.
Thanks, buddy.
You guys look great.
You always look
This is
great,
why I'm
too.
on this side.
Yeah, it's snowing outside. What are you wearing that for?
I'm sweating a little bit. I'm not going to lie. The lights are a little heavy, but well, thank you guys. We appreciate you. And then like, listen, follow Real Talk with a Foot Doc. Below the knee, come see me.